Hello, my name is Mohammad Ahmad Yunus. This is MBA 621. Imagine a healthcare system where everyone gets basic coverage, but some choose to upgrade for better options. This is the fascinating story of Australian healthcare. Today, we will discuss unique blend of public and private sectors, how it functions, uncovering its benefits, challenges, and how we can ensure a healthy future for all Australians. Let's begin. As you can see on the right-hand side, the Australia's health landscape, which includes determinants of health and other demographic factors, health promotion and disease prevention, primary health and community care, specialist acute and residential care. On the left-hand side, there's opportunities and challenges, supporting regulations and infrastructure. On the right-hand side, there's health system fundings, which includes aged care, and then there's Australian government fundings. On the right-hand side, there's Indigenous Australians. So let me give you an overview of Australian healthcare. All Australians have access to safe and affordable healthcare through one of the greatest health systems in the world. It includes federal, state, territory, municipal governments of Australia, which run it together. And the majority of healthcare treatments are free, which are affordable to all Australians. And the credit goes to Medicare and public hospital systems. The health care force includes um, medical specialists, GPs, nurses, allied healthcare workers, and individual is responsible for a portion of the cost for their private medical treatment, both inside and outside of the hospital. So what are the benefits of private healthcare to Australian government and consumers? For the government, it has reduced burden of public hospitals as it provides option to private insurance customers and reduce the burden of public hospitals. Then there's increased tax revenue. Um, Private health insurance is generating tax revenue for the government, which government use to support the healthcare system as a whole. Uh, what is in for the consumers? There's choice and flexibility. Um, yeah, for greater control over healthcare experience, which allow them to choose their doctors, hospitals, and treatment methods. And then there's rapid treatment access, which can lead to shorter wait times for surgeries and specialist consultations. And there's peace of mind when compared to uh, financial relief, and it is definitely peaceful when you are aware of the supplementary coverage and unforeseen medical expenses. Then there's competition and innovation. If we encourage the competition and innovation among private health care providers, then they will contribute to vibrant healthcare market, and the market will definitely improve. Then there's challenges which is faced by both private healthcare and insurance providers. There's financial sustainability due to the rising cost of private insurance premiums. It is less affordable to some Australians. There's out of pocket expenses. Patients need to pay out of pocket, even they have the insurance, but due to limited coverage, they have to pay. Then there's frequent policy changes which the government is doing on regular basis, which creates confusion and discourage among individuals. It's very difficult to maintain private health insurance. Then there's the number of Australians uh, uh, which are declining in participation due to rising cost and policy uncertainties. Is also workforce shortages. The healthcare sector is experiencing a lot of workforce shortage, which includes nurses, specialists, and other healthcare professionals. And then there's efficiency concerns because the private system is complex with different administrative processes, and many processes are duplicated, which definitely um, result in increased cost. As you can see in the picture, the Australian healthcare services, 181 billion is contributed to health in 2016-17, and 90% of chronic diseases account for 90% of all death. And then 49,227 more people died in lower socioeconomic groups from major chronic diseases, which is a great number. Then you can see that how much is spent in Australia. So this is 2020 to 2021, and it goes to 220 billions. It's a lot, which is mostly covered by the Australian government and state government. So what is the recommendation? So as you know, the Australia private healthcare system is facing challenges, which includes rising costs, policy uncertainty, inefficiencies. So how we can make it better? We can introduce value-based care, which includes standardization and transparency in the services, which can be a great and powerful remedy. This can also reduce premiums, expenses, and improve the efficiency of the healthcare system, which can empower consumers and show their trust. So coming to conclusion, I basically um, believe that a model should be embraced, which includes the value-based system, includes predetermined benefits and cost information to affordable citizens, which is efficient in system, and it can gain insurer trust. If we have the collaborative approach, then certainly we can able to sustain a private healthcare sector within the unique dual system of Australia. Thank you for listening to me. This is the end of my lecture.